Breast cancer is emerging as a leading cancer in women in India and worldwide, with increasing incidence, especially in the young women who belong to the age group of 18 to 45 years. It's a major public health concern. Hello everyone, I'm Dr. Pranita. Joining with me today are the experts from Vydehi Oncology Center who will be throwing more light on young breast cancer. We have Dr. Shashidhar V. Karpurmath, medical oncologist, Dr. M.S. Ganesh, surgical oncologist, and Dr. Arpitha S, radiation oncologist. Sir, why should we have this open discussion on young breast cancer?
Yeah. So discussion about breast cancer itself is more relevant now because the most common cancer which affects females is the breast cancer. So breast cancer is the most common cancer in world and it is the most common cancer in females in India. So since the burden of the disease is quite high, it becomes really pertinent and important that we know something about breast cancer and try to have more awareness. So coming to the incidence or what are the numbers. So if you ask me like what are the numbers of breast cancer cases that are detected every year. So it is around 2.3 lakhs cases of new breast cancers are detected per year in India. And if you cut down to Karnataka, around 15,000 new breast cancer cases are diagnosed every year. This is as per the report which has been submitted to the government by the registries. Actual numbers might be still more than whatever is presented because not everything will be captured. So because of this high incidence and high burden, it really becomes pertinent that we know something about breast cancer.
Sir, what are the changing trends in young breast cancer in women in India?
The breast cancers worldwide traditionally happen in older women in their 50s and 60s. But peculiar to India is we see more and more young women getting affected with breast cancer. If we look at the percentage, out of 100 in the world, only 15 are young breast cancer patients. Compared to that, in India, around 25 to 30 or 25 to 30% are the young breast cancer patients in India. That's a huge number, country to country comparison, West to India. So we see more young breast cancer women than in the West. Even if we look at the median age of the presentation, in West it is around 60 years, whereas in India it is around 48 to 49 years. So we see more young people coming with breast cancers in India.
Ma'am, so breast cancer in young women seems to be different from that presenting in the older women. So what is the uniqueness or the peculiarities of breast cancer presenting in young women?
Yes, definitely. As you said, breast cancer in the young women are slightly different from what they are in the older women. In the younger women, they tend to be more aggressive. They present to us in a later stage. And what we have seen is the subtype of the tumors in the younger women tend to be hormone receptor negative. What we call as triple negative breast cancers are more among the younger female. And we also see that the hereditary cancers or the familial breast cancers are more among the young breast cancer patients.
Sir, we would like to understand the difficulties in diagnosing breast cancer in a young woman, sir.
Yeah, so good question. Like basically, we need to know what are the difficulties of diagnosing a lump or breast cancer in young females. So first difficulty is the perception or the conviction that I will have a breast cancer. So anybody, yes, it is by nature we feel that I will not have cancer. But since the incidence is so high and everybody is vulnerable and equal before cancer, anybody can develop. And that too being a young female or young person, the chance that I will have a breast cancer is low is what is the thinking, general perception, which is not true. So, the probability of a person having a breast cancer is equally there in younger female as well as in older female. Since they feel that they are not going to get breast cancer, so they will not be more oriented towards detecting it. Okay, any symptoms are there or any findings are there. So, the first hurdle is this, that I will not have breast cancer because I am young. That is the first one because our suspicion is low. Second thing is young females, the dense breasts are there. So once the breast density is more, So the ability to pick up any small lump in the breast becomes difficult either by self-examination or by a clinician. So because of the increased density of breast, the ability to pick up a small lump will be difficult. So this is the second challenge. Third challenge is whatever the modalities of detection are there. Like basically the lump is detected by doing a mammogram. That is nothing but a X-ray of breast. And this mammogram is not very effective in young females, that is people who are less than 45 years, because of the density of breast. So again here we need to do either a ultrasound or a higher version of imaging, that is dedicated MRI or MRI mammogram. So these things are again not easily available in all the centers. These are high-end investigations that MRI breast has to be done in a particular center only. So cost issues are there, which the MRI breast can cost more than a routine mammogram. So because of all these issues, I think the ability to detect breast cancer in a young female definitely is much more difficult as compared to detection of a breast lump or breast cancer in elder.
So once the breast cancer is diagnosed, we face challenges in treatment because there are various modalities of treatment like radiation therapy, chemotherapy, and surgery. So what are the difficulties that you face or the patient faces while offering surgery, especially in women with breast cancer who are young?
The surgical aspects related to breast cancer management include 2-3 issues. One is operating on the breast, second is operating on the armpits area, what we call as axilla. And third important aspect is reconstruction. What is removed, the area which is removed has to be reconstructed. In some women, please. The peculiarities or the issues concerned with women who are young is first is cosmesis. They are very worried about not losing the whole breast definitely. So the mastectomy, as it is called, the whole breast removal, is becoming extremely rare in young women. We don't offer it at all unless it is really indicated. Second thing is, if a part of the lump is removed, which is usually the case, beyond a particular volume of the lump, we require it to be reconstructed. So it involves one more surgical procedure. Both of them are more common in young women than in old women. Third important thing is, the bigger the tumor size, the bigger is the defect and bad is the cosmetic outcomes. So most of the young women opt for upfront systemic treatments to decrease the size of the breast lump and then go for surgery. That way the treatment is slightly different in most young women compared to older women. This is one very important aspect patients who are young should know. Second thing is, most women are worried about the scar placement, where the scars are placed, whether they are visible over the garment area. These are very specific for young women. They are working and they are moving along with the society, so they feel very, very conscious about these things. So a surgical oncologist or a breast specialist will take all these things into account. And second thing is operating upon the armpit area called as axilla. The most important part of the concern with young women again here is that one should be very, very careful about causing morbidity to the arm. Most of them are professionals. The importance of their upper limb in work, day-to-day work in their professional career is very important. So our minimum we do in the axilla based on oncological science and sanctity is very, very important. So this has a much bigger bearing in young women compared to older people.
Ma'am, radiation is often offered as an adjunct to surgical treatment. So what are the challenges faced by young women who come for radiation therapy?
Yes, definitely. Radiation therapy will be required after breast conservation surgery. And earlier, the radiation treatment would go on for 5 to 6 weeks. And for anybody coming to the hospital every day for 1.5 months is a big problem, especially for young women who are working, who have their family commitments. It used to be an issue. But with the advent of newer technologies, we have such good technologies in the present day that we are able to do the same treatment within 3 to 4 weeks. And in fact, in select cases, we can cut it down to 1 week itself. And radiation therapy is just a daycare procedure. The patient can come, take it, and go home within half an hour to 1 hour without staying in the hospital at all. And radiation therapy does not give any major side effects, so the patient can carry on with their regular life activities as they were before. So there is nothing to have any apprehension regarding the radiation therapy. The young women who are working, who have other commitments, can carry on with their life as it was earlier.
So, what are the challenges in treating a young breast cancer women from medical oncology perspective?
Yeah. So treating the young breast cancer, like basically systemic treatment. Systemic treatment means either chemotherapy, immunotherapy, targeted treatment, or hormonal treatment. So these are the modalities which are used depending upon what are their subtypes. They will be used in breast cancer patients. So pertaining to these modalities in a young breast cancer particularly, definitely it is challenging to treat a young breast cancer because chemotherapy, I think it's a general knowledge that once we give chemo, the chance that a person has chemotherapy induced nausea and vomiting is there. Even though with modern medications, the incidence has come down, but still there are few people who develop nausea and vomiting. So this incidence of nausea and vomiting in a young female after chemotherapy definitely is much more as compared to a person who is elder. So it indirectly tells us that an elderly female can tolerate a chemo better than a young female with respect to nausea and vomiting. So that is one. So we need to be careful when we plan chemotherapy for young breast cancer, taking into account her increased risk of nausea and vomiting so that we incorporate more and effective antiemetics. This is one. Second thing is most of the young breast cancers, even though the literature varies from region to region, but in India, generally the young breast cancers are triple negative. That is, as already has been discussed by Dr. Arpitha, that hormone receptor expression is not there and they are called as triple negative. So once they are triple negative, there is a chance of incorporation of immunotherapy. So immunotherapy are the latest advanced molecules which are available in the treatment of cancers, which have made a dramatic influence in the outcomes. So ability to use a immunotherapy is more in a young breast cancer as compared to elder. Not generalized, but if you take from region to region, yes, or chance of using it is more. Third thing is regarding the hormonal treatment. So hormonal treatment, like even though we say most of them are triple negative, some of them are receptor positive. So this receptor positive means we have to administer hormonal treatment which will act against the receptors. So that means that she is a young female, she has to have a family, reproductive health is affected. So before we start a chemotherapy, or before we start a systemic treatment for her, we should discuss the chances of her having amenorrhea, that is no menses after treatment, or chance of her becoming infertile after treatment. So since this risk is there due to chemo, so there is a unique challenge for a oncologist to treat a young breast cancer where we try to preserve her ovarian function during the course of treatment. So like there is a concept called as ovarian suppression. Like during the chemotherapy, we give hormonal injections and suppress the ovarian function and then give chemo. And once chemo is over, we stop this so that the ovarian suppression is stopped and they can have normal menstruation and reproductive life. This is one more most important thing which will affect a female actually. Then there is a question of childbearing and cancer, which I think we'll discuss subsequently. So, if you ask me the uniqueness of in breast cancer treatment from medical oncologist perspective, these are the ones. That is more nausea and vomiting, incorporation of immunotherapy, ovarian suppression, and fertility preservation.
Since most of the women who are diagnosed with young breast cancer are working women, it's important to know the challenges faced by them and the treatment implications. Sir, can you collectively tell us the challenges faced by the working women? So, can you tell us a few words?
Yeah. One thing is, since as you pointed out, that breast cancer, young breast cancers, now most of them are working women actually. So, treatment is not a simple treatment. It includes surgery, chemotherapy, hormones, and radiation. The duration is for almost a period of around 6 months if we combine all modalities. So, throughout these 6 months, are they able to go back to their work, or how is their lifestyle affected? I think definitely it's pertinent to know about that. So coming to the systemic treatment part of young breast cancer and challenges faced. As we all know, like basically the main aim of treatment is to get back to normalcy. The treatment is not meant to make the patient bedbound or bedridden, complete treatment, not like that. The main aim of treatment is they should go back to their normal routine and life as much as possible. So how this is possible? So this can be made possible like with the newer modalities of antiemetics, better supportive care medications which are available, option of avoiding chemotherapy, like give only targeted treatment or give immunotherapy or give hormonal treatments, has made their life more easy. And in fact, it has made our life also more easy because we are more happy to avoid chemotherapy in as many people as possible. So since chemotherapy is once in 3 weeks, like every 3 weeks, they were to come to hospital to get the treatment. But it is done as daycare procedure. No need to get admitted. There are people who are on treatment but go back to their work, and then when the chemo date is there, come back and take treatment, and one day rest and next day they can initiate. Doesn't mean that everybody can do, but most of the people who are working on treatment on present modality chemotherapy, yes, they are able to continue their work. This is one. Second thing is regarding the toxicities and how it impacts their day-to-day life. Since they are not at home and they are working, they have to mingle with society and interact with various people. Once chemo is given, most of the chemotherapeutic agents will cause hair loss, which is the most conspicuous side effect and which is visible. So we have to accept the fact that hair loss is there. So how to overcome these issues? Like there are various options like wigs are available, hair implant transplants are available. So generally the quality of wigs also has improved quite a lot from what it used to be 10-15 years back, which are almost close to the normal, and it will be not possible to make out whether a person is wearing that wig or. So that is one option, because we have to cope up with that, because obviously they will find it odd that hair loss is there and I am supposed to go back to work. Most of the people are okay not to use wigs and go proceed with their routine day-to-day work. Yes, happening. Some of them, yes, they are more conservative. They want more time to adjust to that. Those people will go for the wigs and still they are able to continue. Other side effects like vomiting, nausea, weakness, which I told, I think most of the people with better and advanced supportive care medications are able to tolerate. They are not bedbound or they are not restricted to home. So they are able to carry on the routine activities. I think these are the few things which probably are important, which we should be aware that we will be able to continue doing our work on treatment. So this, I think, point has to be taken note.
I think that is very much important, sir. So, can you tell us a few words regarding the challenges faced by women from surgical point of view?
As I reiterated earlier, there are three important things every young woman who's working is concerned about. One is cosmesis, second is quick return to work. They want a very quick recovery. Third is pain and complication-free surgery. So if you look at these three aspects, a quick recovery is possible in most breast cancers, contrary to the misconception that surgeries are long or they may have to be hospitalized. Most breast cancer surgeries are daycare procedures now. They come in the morning, get surgery, mostly they walk off evening or maximum by next day. That is the status for 90% of surgeries done in young women. So they choose a weekend, come for surgery, they are ready to go back to their work to start from 2-3 days. I think that sort of tells the status of the present day breast surgery in young women. Second thing, cosmetically, the way we do is to hide scars by using minimally invasive procedures, like we do robotic breast surgeries now significantly. They really hide scars, very small incisions, but at the same time, oncologically very, very safe surgeries. Similarly, if you have to remove ovaries to have hormonal treatments, we do through robotic. The recovery is pretty fast. All these procedures are pain-free for anything. So cosmesis is taken care, quick recovery is taken care, pain is taken care, And we also put what is called as implantable devices. For young women who are working, the hands have to be free when they undergo chemotherapy. So during primary surgery or even before chemotherapy, we put these implantable devices called portacat or chemo coats. All the chemotherapy can be delivered to it. The hands are free to be worked. They are free of swellings and all those things. Like this, surgery has made rapid strides in the last decade so that the complications faced by young working women is pretty less, recovery is pretty fast, and their professional work is never affected much.
Evolution in all the treatment trends in chemotherapy and surgery, I think convenience and comfort to the patient is more important. So, with this note, ma'am, what would you say how radiation therapy is making a difference in working women?
Yes, as I mentioned earlier also, during radiation therapy also the women can continue to work, and we also tailor the timings of the radiation in such a way that they can either take it and go back to work, or they can finish their work and come back to treatment. So they can continue their normal lifestyle or normal life as much as possible. We make sure that the women are back to their normal life. And other myth is, among the women, that while the radiation is going on, they should not be going near the gas, or they should not be cooking. And many women feel they should not be going near their children also. All this is a pure myth. They can be as normal as anybody else is. So radiation is not going to come in the way of their normal life.
So, this informative discussion on young breast cancer comes to an end. So, let us ask a few concluding remarks from our experts. Sir?
We have now learned that young women can develop breast cancers, but not everyone is at the same risk. Somebody can be at low risk, somebody can be at intermediate risk, somebody can be at high risk. So there are well developed algorithms and methods to know who's at which risk. We are in the process of developing a cancer risk application which will be launched shortly, where women can easily know, especially young women can easily know which risk category they fall in. That's my concluding statement.
Okay. So, what are your comments?
Yeah, coming to conclusion, why I always give the concluding remark is the most important one, because after listening to all the theme, if you don't know what we should remember, then it's of waste. So concluding remarks simply is, young breast cancer is not a myth or it is not a rarity. Anybody can develop cancer. Young breast cancers are different compared to elderly, they are more aggressive. Treatment modalities are same, but treatment challenges are there in treating. But with the available treatment modalities, definitely young breast cancers also are curable. So I would like to conclude with these remarks.
Ma'am, would you like to say a few words?
So everyone should remember that cancer is not the end of the road. There are advanced, newer treatments and techniques available, so which will definitely offer good cure and very good quality of life after the treatment.
So, thank you, everyone.